how much?
I mean, that also we last time in that place we arranged some 104.
So at least these will be able to cater the needs of at least 200 jobs.
New medical college, aims that are coming out throughout the country. A lot of nurses potential, they have been absorbed there. So there is a temporary deficit in the number of nurses. So that is a big concern. Otherwise, infrastructure-wise, oxygen capacity-wise, I think it is well up to the mark to respond to any situation that might arise.
As far as manpower is concerned, it's not only in your institution, but the same thing was raised by the Dimapur hospital yesterday also. So medical department, unfortunately, medical department is the third largest or highest employees in the state next to police, education and medical department, nearly 10,000. But I'm sorry to say that the non-technical employees is about 64 to 65%, and the technical is hardly 35 to 36%, which means there is a huge requirement of doctors and the nurses and the technical. We have more of the third grade, fourth grade, which is not required much in the department like health and family welfare. So we are looking at it, and the manpower rationalization committee is in place, and we will be making a statement and bring to the kind notice of the government for necessary action. So as far as manpower is concerned, I think this issue we can discuss during the time of our maybe meeting, executive committee or governing council meeting, so that how we can able to address it. COVID in Nagaland is not panic till now. We have about 3 positive cases, which was detected recently, but they are okay. And our health workers, doctors are monitoring their cases. And we cannot force you to start your BSL immediately because we don't have the, much positive cases because Kohima is tackling the cases. But just want to request all of you to kindly mentally keep ready to do the servicing, and any eventuality, we may have to use the facility that is available. And as we were visiting the infrastructure, we were sharing also, like COVID was a blessing in disguise for the, not only our state, our nation, but even for the world actually, the importance on health sector. And, how we were panicked during the first wave and second wave. And particularly during the second wave, we had to rush from post to pillar in search of ICU, in search of oxygen. That was one of the, darkest period rather. But with all this experience, our state now is better equipped. This hospital alone can able to cater the needs of at least 200 ICU, oxygen bed capacities is available. Yesterday we have visited District Hospital, Dimapur. Yes, they are also equipped better than that of in the past. Even Moon also. So in all the hospital, I think we will assure that it will not be like in the past. The serious patient need not rush all the way from Nagaland, Kikheto, Zinyabato, or for that matter, Tongsang, all the way to Dimapur and Kohima. I think with all 10-bed ICU that was launched by our Honorable Chief Minister on 6th of January this year, the ICU beds are available throughout the land and breadth of the state. And our Minister P. Paiwan Konek, Honorable Minister, is also having a burning desire actually. He's a young, energetic, and he is always concerned for the health care of our people. And every day, every night, we are updating, we are monitoring the issue, particularly the COVID issue in our state. So we would like to request the management that yes, there is no panic. We have one of the lowest positive rate in the country, which means as of today, we have only 3 patients, which is also not very just serious as such. So there is no panic, but in case of any eventuality, please get it ready with all your equipments and the infrastructure available. I have stated yesterday also, but I thought that it is only in district hospital, but even here, the demand for dialysis is very high. The Mapur yesterday, we were told that there are about 80 patients who are in the queue actually. Now, today it is 90. So I think we need to address this seriously, and I think all the doctors, I keep telling that God cannot be everywhere, so He created angels, and angel was also not satisfied, so He created doctors and the nurses to look after the patient. So it's you should discuss among yourself and have a research on it. What kind of diseases are more in our state, right? So you need to, where there is a demand, you need to supply, right? So you have to educate us, you have to tell us, you have to bring to the kind notice of the government, or awareness need to be created in the minds of our people, right? Because we have, last time, there was a requirement of cardiology because of the visit of Honorable Home Minister to Moon. And we have only one cardiology which is positive here in your hospital, right? So we requested all of you said it, but you said that you cannot spare it because there are a lot of patients. So we have to hire from Assam, all the way from Assam, right? So that way we don't have, so we need to create an awareness in the minds of our people and educate our youngsters, which are the, they need to go for further studies. So I think this dialysis issue, I think that is also one area we need to address seriously. So far, so good, and this is one of the most important institutions, and we appreciate that you are in a position to keep up on the basis of the commitment that was made between the CIHSR and the state government, right? So we will continue to work hand in hand. Whether pandemic or no pandemic, I think it is we, not I. This hospital is not I. And even if you start thinking that it is I will bring illness, so we will continue to focus on we for wellness, right? So this hospital belongs to all of us. And I would assure you that we will keep coming, visiting any issue, and next time I'll come along with my principal, director, and other officer, and we can have a discussion, right? So that we can able to deliver better materials. Let me tell you, this is the place, when the government has decided, this is the place we visited, Setavi, myself, we prayed, followed by our Honorable Chief Minister and Deputy Chief Minister. We were there. Again, we, surveyed the spot, and the work was started. And within a record time, actually, and Sachin was the joint or additional secretary of agriculture under me. So government has entrusted Mr. Sachin, and you can see such kind of infrastructure was completed within 3 months, right? I think less than 3 months.
A little more than 3 months.
3 months, yeah. So, you know, but as stated, once the infrastructure was finished, I think Corona was almost over that time. But then, for any eventuality, the facility is still available.
Yes.
So, yeah. So we would like to go and see a similar infrastructure in police complex, where I think I've been more than, until we have been more than 10 times. So 100 better. So in case of anything, we just want to bring to the kind notice not only to our people that infrastructure is ready, but even to Corona, we want to convey that we are ready. It's okay. So I'm requesting to all the doctors. In fact, I have requested the private doctor association also. As you know, that Government of India has launched Jan Ashadi schemes, the generic medicine actually, which is tested and which is quite cheap actually, right? I think some medicines are to the extent of 70–80% cheaper than that of what we are getting from the market. And the quality-wise also very good, I am told. So I think I would appreciate if you can kindly request the doctors of this institution to prescribe the Jan Ashati medicine, that is generic medicine, at least particularly, at least for the poor patient, right? And I don't know whether you are implementing CMHIS here.
Yes.
So the other day we had a discussion and we have come to know about the rate is, package is very low. And we have also done as per CG, Central Government Health Scheme. But the team is working on it. And we also decided to enhance the package, okay? And we would like to see that as far as possible, any patient who can be treated within Nagaland, we would request them to get the treatment from Nagaland itself. And you know, since there is an issue pertaining the amount of the package, I was requesting the doctor, if you prescribe generic medicine, Jan Ashati scheme, I think it can able to cover the scheme without any problem. Because medicine is also one component which is costing them too much actually. So I would appeal that please prescribe the generic medicine, and so that the patient, the needy patient are benefited, you know, and they can able to come within that CMHIS, right? So this is a humble request to all of you, yeah.